I'll just talk. This presentation is about principally a report called our Uncashed Dividend that we put together, the Climate and Health Alliance and our partner, the Climate Institute, last year. And essentially this is to bring together a whole body of evidence that exists in the peer-reviewed scientific health and medical literature about the benefits that accrue to health and well-being from strategies to cut emissions. So when we implement strategies that might be aimed at reducing our climate impact, the benefits to health are very significant and are perhaps not well understood. So we wanted to make that evidence more available to policymakers, to advocates and to the community more broadly, so that people understand that these benefits are actually very powerful. And in the words of some, that in fact moving to a low carbon economy is a big public health advance, and that framing of the issue and an awareness of the evidence that lies behind that can help to build a motivation for climate action and support for climate mitigation and adaptation policies. So I'm going to try the tab. So this report not only brings together a whole body of literature from the health and medical literature about the evidence of the physiological benefits, but it's informed by the communications literature about what works in terms of framing climate change. And what we do know from that literature is that, and we know intuitively, that people care about their health. I mean, we see that in the polling coming up to every election, that health is always one of the top 3 things that people care about. Climate change, depending on what's going on at the time, might be down around 8 or 16. So the idea is that by linking the 2 things together, that you can pull climate up the list and make it more of an area of concern if people understand what the implications are and the relationship with their own health and with population health and well-being.
You want me to do the tapping?
Maybe. Thanks, John. So this is just to share with you some of the literature that's out there in the climate change communication space about health. The Centre for Climate Change Communication, George Mason University, produced this resource a couple of years ago now about conveying the human implications of climate change. So very useful resource. How to talk to people about climate change in ways that are meaningful and bring people into it, so that we're not talking about climate change as just a global environmental issue that we know that people see as distant in time and space and may not necessarily see as something that's personally relevant to them. They've also done very useful research. These are some of the researchers at the Centre for Climate Change Communication, Ed Maybach in particular, Anthony Lizarowicz and Theresa Myers, Matthew Nisbet, all people who published a lot in this space. They've looked at the attitudes and knowledge of health professionals in terms of climate change, and their findings are really very sobering, that many public health bureaucrats and public health practitioners don't actually understand, this is studies in the US, don't understand really the implications of climate change for health, and that's influencing their ability to communicate about the topic to people. It's influencing the preparedness of the health sector in terms of getting ready, developing policy, and developing, the preparedness of the sector to respond to some of the challenges. This more recent study builds on an earlier study which was testing the health message with different audiences. So what they initially found was that health was something that led to people seeing climate change as individually relevant, as something that was personal and beyond a kind of global environmental issue. This more recent study last year compared different frames across different audiences in the US. So some of the work that they have done with the Yale Centre for Climate Change Communication, I just forget the name of that unit exactly, but it's certainly with Yale, was to segment the US population into different audiences in terms of what they knew about how they responded to climate change. So they've tracked these different groups over several years now, and they range on a trajectory from the alarm to the dismissive, and there's concerned, disengaged. I haven't quite got the list of them all here. But what they did with this particular study was to try 3 different frames with those groups and to see which ones were the most effective. So they used national security frames, environment frames, and health frames. And what they found was that across different groups there's varying responses, but the one that was received most positively across all groups was the health message, whereas the environment frame, which is traditionally the messaging that we use in climate communication and climate campaigning, actually led to a sense of fear among some groups and anger among others. And national security also had similar responses. So I think that that's very important. It's not possible in all climate campaigning perhaps, or environmental campaigning, to bring in a health frame, but it does suggest that where you can, that it is a message that people are receptive to across a whole range of different audiences, and it can be very effective. The other important thing about that study is that they found that not only was the health frame received positively, that people were willing to hear it, and that they saw it as relevant, but it led to a sense of hope and optimism, particularly if you talk about the health benefits of climate action in contrast to the health impacts of climate change. So I think that those are useful things, and obviously creating a sense of hope and optimism about climate change is very important in terms of bringing people with you on the issue. Thank you, John. Okay, so this is our report called Our Uncashed Dividend. It was a joint project of the Climate and Health Alliance and the Climate Institute. So the uncashed dividend refers to what the opportunities are in terms of economic savings, suggesting that there's really an opportunity here that we're not harvesting by climate action, and that we're not even realising and taking advantage of in terms of the messaging. Unfortunately, this report came out in August 2012 and is a little bit late to kind of influence carbon pricing discussions, but I like to think that, you know, we could have changed the conversation in Australia from, you know, the action on climate change is a burden, that it's an economic cost, to a different kind of conversation if you talk to people about what the opportunities are for improving health and well-being. And what that also leads to is considerable economic savings associated with the avoided ill health and productivity gains that come from the population health improvements. So some of our report is influenced by this study that was done by the Health and Environment Alliance in Europe, and very powerful research that looked at did some modelling on what the health benefits would be if they moved to stronger emissions reduction targets in the EU. So what they found was if they moved to a 30% by 2020 target, so up from their current 20% by 2020 target, both still, you know, manifestly inadequate in terms of what we know we need to do, but considerably stronger than the 5% by 2020 target we have here in Australia. They found that that 30% by 2020 target would actually deliver about around €80 billion a year in avoided ill health and productivity gains. And that was just looking at the improvements associated with improved air quality. So moving to cleaner, renewable energy sources would deliver massive improvements that would lead to avoided ill health and productivity gains that would lead to those savings. So what that also demonstrated is that far from being the cost in terms of implementing those strategies, the savings for health can largely offset the costs associated with taking the mitigation action, and it may, in some cases, even exceed it. So the Lancet produced, which is a very respected international medical journal, produced a report in 2009 that looked at the benefits to health across a range of sectors. The stationary energy sector, household energy, because particularly in developing countries the burning of biomass is creating a lot of pollution that has health consequences. They also looked at transport and food and agriculture. So a lot of this research informed the report that we produced, Our Uncashed Dividend. So this is one of the areas that we looked at, covering similar areas to the Lancet Health and Climate Change series, such as energy generation. But we also looked at land use and the health benefits of biodiversity and healthy ecosystems. So in terms of energy, we pointed to the evidence that burning coal for electricity generation in Australia is costing $2.6 billion a year in direct health costs. And if you include the climate and environment costs to that, that would bring the toll from coal to around $8 billion a year. So it's well understood that the mining and combustion of coal carries serious and well understood risks for human health, including diseases such as asthma, lung cancer, kidney disease, and contributes to the risk of stroke. Pollution from coal-fired power affects lung development, increases the risk of heart attack, and it can impair intellectual development in children. Coal mining is not only a hazardous occupation for underground miners and causes permanent scarring of the lung in coal miners, but it's also associated with higher rates of cardiovascular, lung and kidney disease in people living in proximity to coal mining. The transportation of coal leads to communities being exposed to coal dust, which contaminates water and causes air pollution, which has also got health risks. So moving to cleaner energy systems can reduce that toxic air pollution and reduce the risks to health. And there are important associated economic benefits along with that. Modelling in Europe shows that reducing emissions by 2/3 in the energy sector could save 50,000 lives each year, for example. So the air quality improvements can save billions of dollars in health and environmental benefits. So I'm just trying to get my notes and move a bit slow. So there's very significant benefits to health from improving air quality in developing nations, and in this report we cover the evidence that black carbon is a significant contributor to climate change and is also responsible for 1/3 of the annual deaths worldwide from chronic lung disease, and that causing the deaths of 2 million people annually from chronic obstructive pulmonary disease, lung cancer and pneumonia. Globally, air pollution causes 1.34 billion deaths each year. So there are powerful incentives for improving air quality from that perspective. In Australia, we know that air pollution kills more people than the road toll. And the 2012 OECD Environmental Outlook report suggests that without policy action, that air pollution will become the biggest cause of environmentally related deaths by 2050. So this figure is not in our report, but I'm aware that air pollution is estimated to cost New South Wales around $4.7 billion per year in health costs. The other important thing about air quality is, and in terms of the health messaging about the health co-benefits of climate strategies, is that while the climate benefits accumulate in the long term, the health benefits can be realised very quickly, and we see that in particular in relation to air quality. The sudden reduction in air pollution following a ban on burning coal in Ireland in the 1990s, for example, was associated with marked and dramatic improvements in respiratory health. A study that published recently about improved air quality during the Olympics in Beijing, when they shut down so many of the roads, found that the improved air quality had an immediate effect on cardiovascular health among healthy young people, and that was just for a 2-week improvement in air quality. Yes?
Linked to that, I was going to say, do you know any stats about Hong Kong that we could use? Health effects of water pollution in like Hong Kong and Beijing?
Yeah, well certainly in China. I'm not aware of specifically in Hong Kong, but if you wanted to contact me afterwards, I can certainly point you in the direction of some of that. So thank you, John. Next page. So this chart here is just making the point about the economic value of reducing CO2 relative to the costs that it might be to implement strategies to reduce emissions. So a recent review of lots of different studies found that improving air quality returns an average benefit of $50 per tonne of CO2 avoided. So, when you look at what we were proposing, $23 per tonne carbon price, still very good value and considerable benefit. A less well-known type of air pollution is that of ground-level ozone. Ozone is produced in the presence of sunlight and warm temperatures and volatile organic compounds that's produced by fossil fuels, the combustion of fossil fuels for transport. And in Australian cities like Sydney and Melbourne, ozone levels exceed the national standards several times a year. So we haven't yet done the work to evaluate the economics around health and the costs of ozone pollution in Australia. But a 2011 study by the Union of Concerned Scientists in the US suggests that ozone will cost the United States $5.4 billion each year by 2020 and cause almost 3 million additional acute respiratory attacks. So moving away from fossil fuels for transport is not only an urgent imperative from a climate point of view, there's very compelling public health reasons for doing it. Thank you. So transport, we talked a little bit about the air pollution benefits associated with that, but there's also direct and immediate health gains possible from changing the way we move and reducing our reliance on private vehicles for transport through investment in improved public transport and more active transport. Taking more trips through walking or cycling offers substantial opportunities to improve health. So those include reduced incidence of chronic disease, in particular respiratory and cardiovascular disease, reduced obesity from increased physical activity, reduced incidence of diabetes, reduced illnesses and deaths as a result of the declining air pollution, and reduced road injuries and deaths. And that's even taking into account that you've got more pedestrians who are perhaps at more risk. The evidence suggests that there is the reductions will be less. Something that was really interesting to me when I was doing this research is to find that active transport significantly reduces the risk of breast cancer in women. It's really powerful studies showing that it's a 40% reduction in breast cancer risk among some groups of women who cycle regularly, for example. So very compelling reasons. I mean, we cover some of the costs that are associated with that. Again, some of the numbers are extraordinary. I mean, one of the figures that we came across was that in the UK National Health Service, that they spend $5,000 per minute treating diseases that could be prevented from regular physical activity. So the message is that, you know, the solutions that are available to us are actually relatively simple. They're potentially inexpensive. They're good for us and they're good for the climate. So it's you know, that's the message from this report, is that it's a win-win-win. It's a win for the climate. It's a win economically, and it's a win for health and well-being. Thank you, John. We also looked at the energy, what could be improved for health in terms of improving the energy efficiency of houses and buildings. So improving insulation, protecting vulnerable people from large fluctuations in temperature can deliver important health benefits. But greening our environment in cities can reduce emissions by reducing the amount of energy required to cool them and protect health. So, and green spaces, very important for mental health and well-being, but urban forests also act as very important filters for air pollution and help reduce the heat island effect, which is one of the significant health burdens associated with climate change in Australia. So again, you can reduce emissions by reducing energy use and save money, which in itself is an important issue in relation to health. So protecting our, actually I might just go to the next, oh hang on, no.
Oops. Oh, sorry.
Yes, it's a mouse now.
We're just quickly talking about, no, okay, we'll go to
Can you tap the side and it'll go
energy
backwards?
efficiency.
Not quite sure how to do that.
Mouse, I think you're going to use
You have to go to the mouse, do you?
and right click in previous.
You can't go back here.
Try it.
No.
So use the
No,
mouse.
that's wrong.
Does that look good? See if that's the mouse. Spin it around a bit. Right click,
Yeah.
and then go previous. Second one down. Yeah.
Oh.
And do that a couple of
Do that
times. Then you go
twice.
back one, and then do it again.
Very good.
Okay.
Right.
So just quickly on
I think
the
I'll,
issue
put
of
the mouse up.
around protecting ecosystems, we felt it was important to point out the links between health and a healthy natural environment. And many people, perhaps due to our largely urbanised global population, have lost sight of the fact that human health and our survival depends on a healthy natural environment for those ecosystem services to deliver clean air, soil and water, as well as many naturally derived medicines. I know that was really of interest to the Senate inquiry into biodiversity. I think it was last year. them hearing that so many of our medicines that we rely on in healthcare actually have biological origins, and that protecting biodiversity from a very selfish point of view is necessary if we want to protect the sources of those medicines. Healthy landscapes and waterways provide vital ecosystem services in terms of recycling of waste and supply of nutrients. Australia's natural ecosystems are our biggest natural store in carbon, and they offer the potential for huge emissions reductions for drawing down carbon dioxide. And again, urban vegetation being very important in terms of absorbing air pollutants, helping to mitigate ground level ozone, nitrogen dioxide, and reducing emissions from energy consumption. Just to finish by talking about food, we can eat our way to better health and a safer climate. So there's big opportunities for reducing emissions in our food and agriculture sector by moving more to a diet and an agricultural system that's based less on an intake of red meat. And what that offers for health is the opportunity to reduce our risk of bowel cancer and heart disease and obesity, all linked to an intake that's high in animal fat, as well as limiting the production of methane that's associated with livestock farming. That's probably enough. Yeah, so in summary, what this report serves to point out, and we've got copies here if people would like to pick one up, or it is available for free on our website, is using what we know about framing the health messages to communicate that there are very substantial benefits to health from strategies to cut emissions, that these strategies and that these benefits amount to considerable economic savings, and importantly they're available immediately while the climate benefits accumulate in the longer term.
Thanks very much, Fiona.
Thank you.
That's great.